and welcome to another episode on MFM Podcasts, host called Beyond the White Coat, the podcast that takes you on an unforgettable journey into the lives of doctors. I'm Dr. Selina, founder of Medic Footprints Malaysia, a platform that connects doctors to diverse careers in healthcare. If you have not followed our podcast, be sure to hit that follow button to follow our channel. Now, in today's episode, we are exploring doctors in alternative careers. Now, our podcast guest today is Dr. Zaireen Ahmad Zamri, who transitioned into the insurance industry. She's currently the Director of Medical Affairs for a company that's providing managed healthcare services to corporate clients ranging from SMEs to MNCs. She's also the Deputy Medical Director for the Singapore branch. She has been with the company for about 2 years now. Wow, Malaysia and Singapore, how about that? Welcome, Dr. Zaireen.
Morning, Selina. Morning.
Okay, thank you for joining us today. So you are actually one of the success stories. One of Medic Footprints Malaysia's success stories. So tell us a bit about that journey and what made you decide to leave clinical medicine.
Okay, thank you, Selina. So basically, I graduated from the medical school locally in 2003. And since then, the only field that I know until the time that I left was actually clinical medicine. And it came to a point where it became very mundane to me in terms of, the clinical medicine. Every day is the same routine. So it came to a point where I became sort of bored and I needed a challenge daily. I needed a challenge to break away from that routine. So that was when I started exploring on the internet, on doctors who have transitioned to other alternative careers. Because during clinical medicine, we were only taught that, you're a doctor, clinical is the way to go. So the path is always the same: housemanship, MO, then you become a registrar, you get into the master's program, then you become a specialist consultant, and that's it. So I thought to myself at one point, I said, there has got to be another path to this. Not everybody will actually stay on the line of clinical medicine. So that was when I started to explore on Google, explore the stories of doctors who have left, the clinical medicine, what they actually do. And from there, I actually found Medic Footprints. So I actually went and read a lot of articles in Medic Footprints, and it triggered my inner desire to actually push through and to actually reach out to Medic Footprints on my career.
Okay, well, I think clinical medicine, like you mentioned, right? It's a one track only, and it doesn't there's no room for you to experiment and grow and try new things. I guess that's where the boredom came in, right? So, but at one point, when we were getting you that position there, you were still contemplating. You almost didn't take this job. So tell us a bit about that.
Oh, wow. Okay. So at that point, a few factors came into play. And, but, of course, most doctors will try to compare dollars and cents and the experience. But for me, I contemplated it for a few days, and finally I said, oh, you know what? The dollars and cents can grow as long as my experience and my skills grow. So that was the push at the end of it. So that's where I decided to, okay, I need to make that jump.
Yeah, I guess it's because we're not really taught, like, oh, what else is there outside of medicine, right? So when we want to transition and change job, I suppose the only thing we think is the biggest factor is what's my salary bump, right? But
Correct.
yeah, but what about other than a salary bump? What do you think you've gained? Because I understand at that level you transition, it wasn't a very huge bump. But what do you think you've gained most out of it? Like what? Because you had to sacrifice a bit of like as a say you're a GP, you will seek another GP if they give you like 500, 1,000, 2,000 more, right? but this one wasn't that case. So what do you think you gained most out of it? What was the most valuable thing you got out of this?
Wow. So basically, when I took, well, let me just be frank here, Selena. So when I took the pay cut, in my mind, I could only think of, okay, you know what, with this pay cut, I think I can actually upskill myself, reskill myself in the new field. So during that time, when I made that jump into the new field, I just persevered. I persevered. The first 2 weeks was the toughest for me because it was a totally different field. So of course, clinical skills did come in, for me to actually do the work, but there were also other things that I had to really learn very fast, in terms of computer skills, Microsoft skills, and all these other fast-paced knowledge that really pushed me a little bit on the edge initially. But the first 2 weeks was tough. But after that 2 weeks, I felt that wow, okay, this is doable. I know I'm capable of this. So from then on, I just pushed through and I just went on until today. Mm.
Wow. That I guess that starting all over, that's probably the toughest, correct?
Oh, it was very tough. In fact, I remember my second week of doing the work in my current place. I actually shed a few tears because I was too stressed out. I did not know, in fact, I started doubting myself at that time, whether, can I actually sustain in this in insurance in this industry, or should I go back to the GP practice but um you know, my family members, my husband, they were all around me and they said, you know what, I think you can do this. You just need to be patient, persevere. That kept me going. That kept me going.
Well, do you miss being a GP at all, like right now?
Um, Occasionally, yes. I still think so because our daily work it still involves a lot of clinical skills. So sometimes when I me myself and the team, when we adjudicate bills, when we look at the diagnosis and what the doctors have done, sometimes I think, wow, I wish I could be in that position, but it's just a thought. I just feel that at this point, I'm very lucky to actually be in the in my current place, and I would not trade it for anything else.
Oh, okay. What about stigma? Did your friends, family, your community, auntie, uncle, did they say anything about you leaving clinical medicine?
Oh yes, oh yes. Some of them were actually against it. They felt that, the only way to be a successful doctor to them is to actually stay in that line and see patients until the end lah. But for me, I told them, I said, I think my decision is correct, and I said there are pathways to to be successful in my career other than just being a doctor, the typical way of being a doctor, which is to see patients day in and day out. So it took some time for them to actually buy the idea. One of my biggest I would say biggest opponent was actually my father. So he was not agreeable to this, but after a while he actually bought into the idea and he's okay now. Mm.
Oh, I'm happy to hear that things are working out, on even the family and so on. So, since then, tell us. I mean, since the last we spoke, like I said, right at while we were getting you the job. So, what has happened since then until today?
Okay, so basically, career-wise, I think I have grown tremendously. I'm starting to, I'm leading a team of, I would say about at least 20 people and 20 team members under me, in two countries, Malaysia and Singapore. So basically, it's about creating a successorship program within the teams. So from there, I have actually learned, and I'm still learning on how to actually manage people under under my jurisdiction. So people management is something that I've learned, and it's a skill that I have attained by leaps and bounds. The other thing is that, learning on how to deal with the external parties, the doctors, the hospitals, the hospital management. It's not something that is easy, but I feel that it really challenges me to actually be a better person in terms of my communication. I also deal directly with, our clients. So communication via email has also improved by leaps and bounds. Um, in terms of my life, me and my husband, so far everything is good. We've managed to find some degree of work-life balance. Despite being in the corporate world can be very, very hectic. And it's a very fast-paced. Being in this industry itself is a very fast-paced industry. It changes a lot. Policies sometimes change. Demands get higher in terms of healthcare, so this is something that I've learned so far, and it's actually interesting because I'm also learning policies in another country, which is Singapore. So I can basically compare two countries, and which one does not to say which one does better, but basically what I can learn from the other country to be applied to this country. So it has been a very positive path for me so far.
So, what is it about your job that you love about most?
Wow. Actually, working with the other teams, within the same company, but working with the other teams to learn, because, for me, I do not know everything. Even though I'm a medical doctor, I do not know everything, and I need to learn, and I want to learn. And when I communicate, or when I, communicate and work together with other teams within the company itself, either Malaysia or Singapore, I actually learn a lot more, and they can also learn from me. So it's an exchange of knowledge, and information, and from there we actually create a very strong bond or working bond. So basically, they're accountable to approach me, and I'm accountable to approach them, either in Malaysia or Singapore. So that has been the biggest, the biggest thing that I've gained so far.
Wow, it seems like you've progressed like very fast and very far.
Yes, yes, yes. I agree with you. So, very fast to the point that at one point I thought I could not catch up. But I think the mindset is very important. I have to keep a very positive mindset. Of course, there are always challenges. Every single day there are new challenges, new things to learn. But I think it all boils down to the mindset. If the mindset is not closed, and if the mindset says that, what, you can do it, just learn, just enjoy the process, just, go through the process, do not have any negative connotations. I think that is the way to go.
Okay, so you mentioned mindset. Like what sort of like how did you switch? Like what were you before this, and what was it that how did you manage to switch your mindset to what you are right now?
Oh, okay. So initially it was just clinical, patient, patient, patient. Okay. Then when I joined the industry, then I thought, okay, I can still see patients in terms of paperwork and all that, but I said I have to think of other ways to ensure that I don't really lose track, or sort of like drop off the wagon. So I needed to, every day, what I usually do is that I always tell myself, you know what, Zyrene, you can do this, just go ahead, every day in the industry, because like I said, Selena, things move at a very fast pace. Sometimes I feel that I cannot catch up, but actually I can. So every day, right, I put on this cap, a management cap, I would say, that okay, this is not just about clinical anymore. This is about management. So whenever I deal with my team, now there is a mindset that, okay, I'm firm, uh, but I'm approachable. So I'm approachable to them 24/7. So I make myself available. In terms of work, I deal with a lot of the team leads. So I also let them know, okay, you know what? I said I'm available 24/7. So what they do is that in exchange, they are also available 24/7 for me. So the mindset is always is that, we have to persevere. We have to think positive. There are challenges, and some challenges can be very, very intense. At some point, you feel like you want to break, but I usually tell myself, don't break. This is just a learning curve. Once I can manage this challenge, I think if there are other challenges that come in, I can deal with it. That is something that I tell myself every day.
That's very profound. So, what would your advice be for doctors? Because I actually get doctors who are, say, still in service and they want to come out to try other things. But the thought they have is that, oh, first, maybe I don't have the skill, but what if, I cannot compete, like I cannot survive? Because, in the service, you can be complacent and you know that, things are going to still move forward. But if you're going to leave the service, and then it's all about KPIs, your capabilities, your performance, and all of that. So some of them are worried that they will not be able to survive outside. So what would your advice be for these doctors?
So Selena, I think, and my colleagues out there, you have to take that leap of faith, but you need to be very well prepared to commit. I think committing to the job is one thing. Be prepared to take that leap of faith. And number three is that be prepared to actually break out of that mold, that complacent mold, to actually learn. If your intention is to learn and grow in your career, then this is the path that you have to take. There's no two way about it. There's no easy way. Of course, the easy way, or the easiest way to survive is to be is to just stay in your current spot. Anybody can do that. But if you're hungry to actually learn something that is outside of your current scope, then this is the only way to go. You have to persevere. You have to learn. You have to go through the challenges. Without going through the challenges, you won't be able to push yourself further. And if you want everything to be easy, in my opinion, if you want everything to be easy, you're not going to grow. Nothing comes easy. To have that kind of success, or a career jump to something that is more meaningful for you. You've got to go through some challenges, some difficulties, in order for you to actually be able to see the rainbow on the other side. So for me, that is the only way to go. But for me, number one is the mindset. You've got to open your mind to things other than clinical medicine. Number two, you need to have perseverance and patience to actually learn. And number three, basically support. Support is also very important, because things can get very tough, and you need a good support system to be able to help you along the way. But these challenges, they do not come every day, but even the fact that changing clinical to insurance is a big challenge in itself. It's a big jump, a totally different scope of work, or statement of work, or what you call in insurance SOW. So you need to be prepared for that. So of course, I just to share with you, Selena, in the past 2 years, I have been I've been hiring people into my team with different scopes of work. And when they first come in, they always say, I'm very scared, doctor. I said, don't be scared. I'm always around to guide you. But I said, you also need to go through the process, to go through that process to learn. So I said, whatever it is, always take a deep breath, read everything line by line, so that you can understand. Anything that you do not understand, you can always come to me. So that's what I always tell, to my new hires. Mm.
Wow. Okay. Sounds like it's I guess getting out of your comfort zone is very it's very scary because you really don't know what's outside, right? And you don't know if you can survive it.
Correct. Like for me, Selena, I think you also know, I was in the clinical line for about what, almost 20 years, 18, 19 years, and I made that jump. So some of my young doctors were asking me, how did you manage to do it? I said, I just did it. But I said, at the back of your mind, you must always think what you want. at the end of the day, what do you want in that career and how you want to achieve that? So of course, there's always no, is the path is never a bit of roses, in my opinion. It's always, challenges and, difficulties, but it doesn't come every day. I told them, I say it doesn't come every day, but when it does, take it as a learning experience and a stepping stone for you to actually gain more. So I said, you can gain in terms of your skills, in terms of your communication, whatever it is. I said you will gain something out of it. And it's never, I said, you must always think that it is never a negative thing. One of the things that I actually tell some of my young doctors is that when you experience or when you go through something that is challenging in terms of work, always remember that, wow, once I can overcome this challenge, the other challenge that comes in seem either similar to this challenge or other different challenges, you will know you will know how to manage it already. So I said that is a skill that you can use either in work or also in your private life. Yeah.
Yeah, I guess because med school training is written down. This disease, this is how you diagnose. This is the treatment. This is the management plan. It's very clear cut. So, but there is no term for the challenges that are coming in, right? It's not a clear cut disease, right?
Correct. It's not clear cut. There are some areas where it's just clear cut, like insurance industries, there are already written policies. But there are other things that are, wow, this is not so clear cut. Now, how do we go about this? So this is something that that was not taught to us in our, in our medical school. I feel that in medical schools, as time progresses, uh, you know, medical students, they should also be exposed to, at least not a subject, or at least some sort of briefing as to, apart from being doctors, how can doctors be successful in other than clinical medicine? I think there should be a subject or some sort of a weekend briefing. So, at their final year, so they are aware, because I know and I've heard, and I've even experienced this through friends, how some of them actually go into housemanship and they actually drop out because they could not stand the stress, seeing patients, managing. It's not easy for everybody, and not everybody has got the same mindset. We are all we individuals. We are all unique, but I feel that when some of my friends actually did drop out, I knew that they were lost at some point. They didn't know what to do. No APC. At housemanship, what do you have? You don't have any license to actually practice. So what do they do? So they actually they find their way, eventually. But at one point, I did, have a chat with one of my friends who left at during housemanship. She actually told me, "Wow, it wasn't easy. I didn't know what to do for a few good months. I was at home just, sitting down, didn't know what to do." And so then, you know, I felt that, wow, I wish medical schools can just to say prep us to step away from clinical. Of course, we know that the only way for you to get your license, your skills, is actually to go through the clinical medicine. But what if things don't go your way? What are the other options that these doctors can have? So I feel that there should be an independent like body or to actually give a talk. One session or two sessions is enough, especially to the final year students. I feel so that it prepares them for the world, because when you're a medical student, you're in this cocoon like a bubble. Correct, Selena? You are not exposed to the outside world, except maybe to the patients that you see, in your hospital. Even taking blood, also you actually practice it on the mannequin, because you're not licensed to actually take the blood. But the moment you actually go into the clinical world, it can be very exciting and it can also be very scary for some. So I feel that these medical students should be given the option, because as time goes by, you can see that it's becoming more challenging. Patients are more challenging. They can even challenge the doctors. You get all these new diseases, COVID, and a host of other new diseases, on how to manage advances in technology. So not everybody can actually cope with that. So they need to be given the chance.
Yeah, funnily you mentioned that because actually Medical Prince has gone down to like Taylor's University, to IMU to do all the talks with the final year students.
Oh, wow, that's good. That I think that is a very, very good initiative from your end, Zainab. Very, very good. Yeah.
Okay, well, thanks, Irene. Thank you everyone for tuning in to this episode of Post Call Beyond the White Coat, brought to you by Medic Footprints Malaysia. We hope you've enjoyed our discussion with Zyrene, and her story has inspired you and provide insight on how to make a career transition out of clinical medicine. And thank you for listening. We'll see you in the next episode.